video will demonstrate the use of the 1112 Explorer for dental charting. Students may wish to practice different scenarios prior to this evaluation. For this evaluations, instructors will give students scenarios with pretend conditions. Let's begin. We're going to examine tooth number 13 from the buccal for right hand dominant, or 4 from the buccal for left hand dominant. Upon your exam, you will find a defective restoration on the mesial buccal and cervical demineralization along the entire cervical area. The first step is going to be to choose the correct operator positioning. For right hand dominant, it will be from 10 to 11. For left hand dominant, it would be from 1 to 2. Next, you will make sure your patient is at the proper position. Their occlusal table is going to be perpendicular to the floor. So occlusal table of this maxillary arch perpendicular to the floor. The patient's chair height is optimal for the clinician, so when I bring my arms in, I'm going to be keeping my elbows at a 90 degree and be able to fulcrum. Patient is at the correct height. The patient is going to be slightly turned towards me so that I have access to tooth number 13 from the buccal. Make sure my instruments are going to be within reach, and I'm going to make sure that my light is going to be within an arm's reach and directed on the tooth. For video purposes, we're going to take that light now and turn it away to get a little bit better video. I'm now ready to examine the tooth. The first step in dental exam is going to be to dry and look at the tooth. From the buccal, I'm going to dry and look for 3 surfaces: the distal, the direct, and the mesial. I'm going to try to move my mirror to keep it as parallel as possible. I would dry my distal. I'm using air, light, and mirror simultaneously. I would come to my direct facial and then over to my mesial facial. That is going to be considered the visual exam, which is our most important exam. All defective restorations are examined only using the visual exam. No tactile exam is completed. The second item we're going to look for on this tooth is going to be cervical demineralization along the entire cervical area. First thing I'm going to do then is I'm going to get my mirror in position once again using that 3-finger grasp, and I'm going to choose my end selection. I'm going to take this 1112 Explorer and I'm going to go to the distal surface. I need to choose the correct end selection by seeing that that functional shank is going to go up and over the distal. All steps for end selection are found in your manual and on videos on Blackboard, so we're not going to go through all of those, but for right now, that functional shank is going to go up and over the distal surface. Once I have the correct end selection, I'm going to go for that cervical demineralization with my tip headed towards the distal. I'm going to use the last 1 to 2 millimeters, and I'm going to do a light little sweep stroke going into that interproximal. Once I'm done with the distal, I'm going to back out. I'm going to reposition my grasp. I'm going to go to the distal line angle. I am now on the outside of the Explorer, and I'm going to sweep across that cervical area for demineralization all the way into that mesial, because we said that we were pretending that demineralization was on all surfaces from the buccal. So I've examined now a defective restoration with the visual exam and the tactile exam for demineralization across that cervical. Dental findings are going to be recorded as the clinician prefers. The number of teeth you examine before recording depends on your memory and the difficulty of the level of the dental charting. That is the end of the scenario for dental charting 1.